Welcome and good afternoon, everyone. I'm Nazreen from PIDC, and today I'm proud to present our research titled Peer-Assisted Learning, Perception of Dental Students in Learning Clinical Skills. This was a 3-year research conducted with my groupmates Atira and Khayrin, and we were lucky to be supervised by our lecturers Dr. Jaya and Dr. Priyanka. Ladies and gentlemen, what better way to start our introduction if not with definitions? As the Malay saying goes, tak kenal maka tak cinta. Peer-assisted learning, or PAL, is the development of knowledge and skill through explicit active helping and support among status equals with the intent to help them with their learning goals. You might be wondering, why are we conducting this study on PAL? Ladies and gentlemen, PAL has long been integrated in the curriculum by medical students, but it's relatively new in dental. There's limited research. The aim of our study was to evaluate the perception of dental students or tutees regarding the PAL module, and the objectives was to analyze the experience regarding the PAL module and assessment of alternate impression-taking skills learned by the tutees. So here's our materials and methods. So our criteria was that we included the year 3 students, since they just started their clinical years, and the sample size was 22. This was a mixed method study. Our qualitative data was collected through focus group discussion, and quantitative data was collected through questionnaires. So this is the PAL module developed with faculty guidance. 6 tutors were trained and calibrated on alternate impression taking by 2 faculty members. Then training commenced for the tutees in 2 phases. Phase 1 was lecture demonstration from the tutors to the tutees, and phase 2 was the 12-hour clinical practice in the course of 6 weeks. After 6 weeks, there was an assessment done on the tutees, and they were assessed by 2 faculty members and 3 tutors. They then answered the questionnaire, and 4 focus group discussion was conducted. Moving on to our results, this is the assessment results. We presented it in pie charts. From here, we noticed that there's no significant difference between scoring by faculty and tutors. Therefore, proper calibration has been done between the tutors. Moving on to our questionnaire results. From the questionnaire, most of the tutees agreed that tutors explained everything in detail, understood what they were being taught, and communication was easier. In the questionnaire, we also asked open-ended questions where we asked advantages, disadvantages, and suggestions on improvements. In the questionnaire, also we asked them about topics of recommendation which could be used for future PAL modules. Moving on to focus group discussion, from the 3 focus group discussion, we could identify 3 main themes, namely learning experience, communication with peers, and pros and cons. From learning experience, the tutees noted that it was a very good learning experience and they understood what they were being taught, clinical skills. From communication with peers, they were able to communicate easily and were not afraid to ask questions. From pros and cons, the positive aspects was that their confidence level improved and that they were comfortable learning with peers. The negative aspects was that timing of practice was an issue and that the assessment was scary. So peer interaction has long been a cornerstone of dental education, with students learning from their seniors through observing and discussing. Our study highlighted various benefits of PAL. From our results, around 77% noted that communication was easier with tutors. Around 68% enjoyed the session and viewed tutors as friendly and helpful. From our qualitative data, PAL module helped to improve students' learning experience, enhance confidence as well as their clinical skills. Similar findings were noted in studies involving medical and dental students. As they say, nobody's perfect, so we have to acknowledge our shortcomings before proceeding to solve the problem. This study had its limitation. First off, it was conducted in a small group, as it was a pilot study of PAL in PIDC and had not yet been integrated in the curriculum. So tutors find it difficult to find time of practice, and they came with different skill sets and no pre-assessment was done. Here are recommendations for further PAL modules, which is to provide training for the tutors and to introduce formal PAL into the curriculum. As a conclusion, our PAL module showed positive responses in the students' learning experience, confidence, and communication skills. With strategic pairing, time management, and emphasis on accuracy, PAL can be effectively implemented to prepare students for success in clinical practice. After all, based on today's theme, isn't education about inspiring young minds and igniting their fullest potential? We hope that this research can be of benefit to others and that it will help with the integration of formal PAL into curriculum in dental schools. Thank you for listening.